and thank you for tuning in. My name is Dr. Al-Khalaf, a research fellow at the University of Ottawa Heart Institute, and I am host of BEaTS Research Radio. Today's episode is a special spotlight for the 2021 Canadian Women's Heart Health Summit. To tell us more about this virtual conference, with me today is Lisa Comer. Lisa has been with the University of Ottawa Heart Institute since 2009. And is currently the Knowledge Translation Lead for the Canadian Women's Heart Health Centre. This dynamic role allows Lisa to manage a variety of local and national projects aimed to educate, inform, and address the gaps in cardiovascular care, research, and support for women in Canada. Thank you so much for joining us today, Lisa.
Well, thank you very much.
Look forward to this quick interview with you. So our first question today is, as one of the team members involved in planning the program and content that will be available at the Women's Heart Health Summit, could you provide us with a quick overview and highlight some of the exciting information that'll be on display for the attendees?
Definitely. So proudly hosted by the Canadian Women's Heart Health Centre here at the Heart Institute, along with Heart and Stroke, the Canadian Women's Heart Health Summit is the only event of its kind. It takes place next week, virtually, from February 10th to 13th, and will draw the world's leading experts, allied professionals, and women living with heart disease to share up-to-date information about women's heart, brain, and vascular health. This event is accredited with over 19 hours of content spread over the course of 4 days. And this year's theme is Women's Cardiovascular Health Puzzle, Connecting the Pieces to Understand the Whole. And I'm excited to say that we have over 50 national and international experts and stakeholders taking the virtual stage with 7 themed panel sessions, 8 concurrent sessions, over 50 poster presentations, a career networking session for trainees with facilitated smaller group discussion by experts in the field, a Twitter journal club, which will be highlighting 2 high-impact research publications, and there will be a very interactive debate on whether social media can positively transform knowledge translation for women's heart health. We have a Women with Lived Experience networking reception and targeted talks for patients and their caregivers throughout the summit. And what sets this event apart from the rest is that we have included women with lived experience on our planning committee to help shape the program and have included patient perspective on all of our panel talks. We have a number of panel presentation sessions summarizing the latest evidence in emerging needs as a woman in COVID-19 era, where the panelists speak about equity, sex and gender research, and understanding the disparities healthcare providers face during this current climate. Achieving gender equity in medicine and in leadership, the heart, brain, and mind connection, which will focus on stroke and vascular cognitive impairment, as well as mental health as a determinant for cardiovascular health in women. There'll be sessions that focus on heart valves, the arteries, blood vessels, heart failure, and one presenting on the unique challenges in cardiovascular disease within regards to prevention and rehabilitation. But honestly, what I'd really like to highlight today to you are our keynote speakers. Dr. Kara Tannenbaum from the Canadian Institute of Health Research and McGill University will be opening the event with a timely talk on sex, gender, and intersectionality. We're also very fortunate to have Dr. Jennifer Mires join us from Northwell Health in New York City, who will be closing the event with a talk about putting those pieces together and advancing the journey of equity for women's heart health. Now, as I mentioned, next week's event is completely virtual, and we've incorporated networking and engagement activities throughout the program, and you can access the platform from anywhere in the world. Registrants will be able to access recorded sessions from the platform for a full year after the event. So even if you're unable to attend next week, you should register and access the education at a later time. And so this is a chance to get involved in the changing the future for women's heart health. And if you're interested in more information, and of course to register, you can visit womenshearthealthsummit.ca.
Perfect. Thank you so much for that information, Lisa. Our second and final question today is, can you tell us why this kind of targeted approach to highlighting women's heart health is so vital at the present moment? And what can be done more in the future to advance the goals and efforts coming from the Canadian Women's Heart Health Centre?
That's an awesome question, great question. So highlighting women's heart health is so vital because heart disease is the leading cause of hospitalization and premature death for women in Canada. And yet women everywhere are understudied, underdiagnosed, undertreated, and underaware when it comes to their cardiovascular health. And so, for example, heart attack symptoms, will go unrecognized in over 50% of women. Heart disease is largely preventable, with 80% of a woman's risk of heart disease is controllable and related to factors she, along with her healthcare providers, can change. So for instance, smoking, hypertension, and obesity. By raising awareness, improving knowledge, we can help improve prevention and detection of heart disease in women, as well as the care and treatment for women with existing disease. The Canadian Women's Heart Health Centre is working to change the women's heart health landscape here in Canada. And we want to see better quality of life for women and fewer women dying of heart disease. To answer the last part of your question, so what are we doing about all this? Well, the Canadian Women's Heart Health Centre here at the Heart Institute is dedicated exclusively for conducting women-specific heart health research, enhancing care and the prevention and treatment of heart disease in women, improving the outcomes for women, and raising awareness of heart disease in women through our advocacy and educational efforts. We deliver local and national initiatives to improve outcomes of women at risk or living with heart disease. So as well as the summit, there are a few program offerings I'd really like to highlight to your listeners today. Our Women at Heart program is a peer support program which is led by women with heart disease for women with heart disease that aims to create a caring environment for women to learn from each other. We have a virtual care program, and it's available on a virtual platform to people who are at risk for developing heart disease, and that could be due to poor lifestyle behaviors or medical risk factors, and patients who have established heart disease. And that's similar to the virtual cardiac rehab option. Women with hypertensive disorders of pregnancy, so for instance, preeclampsia, eclampsia, gestational hypertension, represent one of the highest risk populations for premature cardiovascular disease. And the Cardiac Event Program was developed here at the Heart Institute as well to address this important clinical problem to support high-risk postpartum program. So we were able to adapt that the Cardiac Event Program specifically for this population. Also, our community advocacy toolkit is a resource we created a few years back to enable women to deliver heart health education within their local communities across Canada and beyond to inform women about heart disease and how they can take appropriate action to reduce that risk. I'd also like to highlight a wonderful initiative that was conceptualized at a call to action meeting that was held at our first Canadian Women's Heart Health Summit back in April of 2016, which is now known as the Canadian Women's Heart Health Alliance. Now, this alliance is a volunteer organization of over 70 healthcare professionals and patients from across Canada, and addressing sex and gender unique disparities in care through multiple working groups focused on training and education, knowledge translation and mobilization, health systems and policy, and advocacy. So working collaboratively, the Alliance mission is to implement evidence, transform clinical practice, and to impact public policy related to women's cardiovascular health. The Alliance is powered by the Canadian Women's Heart Health Centre with funding support from the Ottawa Heart Institute Foundation. And more details around the Alliance can be found on our website at the cwhha.ca. Through the efforts of the Advocacy Working Group, Wear Red Canada Awareness Campaign was created and is already in its third year. Wear Red Canada Day is celebrated annually across Canada on February 13th to raise awareness about women's heart health. You can participate on February 13th by wearing red, taking pictures and sharing them on social media, using the hashtag #HerHeartMatters. And we encourage people to share key messages about women's heart health with their colleagues, family, and friends. People can also learn more about what's going on in heart health at one of our 6 scheduled educational webinars hosted throughout February 13th by members from coast to coast. And we also have a virtual 5K race this year. It's our first ever that begins on February 13th and lasts until the end of February. You're welcome to visit our website at wearredcanada.ca to learn more, and please, feel free to reach out to me directly if you have any questions.
Thank you so much, Lisa, for sharing this information, and we look forward to seeing your efforts in full display in the coming few days when the summit begins. And thank you for checking out this special BEaTS Research Radio episode. Subscribe to our YouTube channel or find us on your favorite podcast app. On behalf of the whole team here at BEaTS Research Radio, stay safe and heart healthy.